Good afternoon, honorable judges. My name is Aji Wahiwardana with my fellow colleagues Adriana Fiola Miranda, Eko Ngadiono, and Rafael Alfa Budiman. It is an honor for us to present you about our systematic review titled Integrated Multimodal Preventive Approach for Type 2 Diabetes Mellitus in Asia, Systematic Review. Honorable judges, the prevalence of type 2 diabetes mellitus has been increasing for the past decades. The number of incidences has increased as many as 4 times as its number in the last 20th century, reaching 422 million cases today. Most of the patients with type 2 diabetes mellitus come from countries with low and middle income, and 60% of those patients actually come from Asia. Honorable judges, as we know, the long-term consequences of diabetes mellitus would impact in the quality of life of its patients, and it would actually be a large economical burden for the country as well. In order to address this issue, a lot of prevention programs have been developed. However, Asia's populations require a distinct prevention approach due to its different genetic profile and diet. Thus, we systematically review the prevention programs that have been done in Asia to evaluate their outcome and to synthesize an integrated multimodal prevention program based on the evaluation that we made.
Next, we move to the methods section. We conducted our systematic review based on the preferred reporting items on systematic review and meta-analysis, or PRISMA statement. We choose observational studies to be included in this review because we believe that such study would describe the outcomes of preventive programs in Asia better than any other type of study. And we searched through 5 databases, and from application, from inclusion and exclusion criteria, we finally included 12 studies in our systematic review. And the 12 studies were assessed using data scoring for RCT and STROBE, or strengthening the reporting of observational study in epidemiology for cohort studies.
Alright, so from our searching, we have included 12 searches, 12 studies that met our inclusion criteria, and the 12 studies we collected around 10,601 participants. Okay, so all of these participants, they come from Asian country, and most of the Asian country that perform this study, they come from Japan, China, and India. So all of these 12 studies, they use a particular or multiple preventive approaches in order to measure the outcome in order to measure the outcome. What happens if they use this one particular preventive approaches. And therefore, we would like to categorize the preventive approaches into 3 main categories, which is the first one is the lifestyle modification, the second one is educational program, and the third one is nutraceutical pharmacological strategies. And not only that, we would like to also quantify the outcome of these studies, and we can see from this graph over here that the x-axis is the type of the outcome, while the y-axis is the number of studies that's performed for this outcome. So as we can see here, there are 5 studies that use reduced diabetes incidence in order to measure the outcome for their preventive approaches. And this is followed by 4 studies that use reduced fasting blood glucose as the outcome for their preventive approaches. And lastly, there are 3 studies that use reduced body weight to measure the outcome for their preventive approaches.
So now we are going to the discussion part. Asian has a high susceptibility to have a diabetes later in their life. The genetic is very distinct, and it has a higher chance to develop diabetes. So it is Asian has this distinct genetics. Asian were born with high level of insulin. This high level of insulin provides a high survivability for the infant, especially in famine times, which occur in high population countries such as India, China, and also Indonesia. So the first, Asia has a genetic susceptibility, and this would cause Asia to have a higher chance to develop diabetes mellitus to increase later in their life. The second thing is Western food. Western food is very popular in Asia, and Western diet consists a lot of fast food, which contain high carbohydrate, high glucose, high sodium, and it is very unhealthy. So Asia has a genetic susceptibility that increases the chances to develop diabetes mellitus, and added with the unhealthy diet, unhealthy Western diet, it would cause Asian to have a very high chance to develop diabetes mellitus type 2 later in their life. And based on the 12 study that we were observing, the studies shows the prevention program has a very effective result in reducing the incidence of diabetes mellitus type 2. However, the program only focused on one aspect of socio-ecological prevention. So this does not apply to everybody, and also it does not apply in all risk factors. So how can we make a program that is sustainable and feasible and also effective, which cover all risk factors in preventing the diabetes mellitus type 2?
We believe that the answer for that question is to propose an integrated multimodal preventive approach. But before we could proceed to making the approach, we believe that there is one more aspect that needs to be considered, and that is the characteristics diversity among Asian population. We know that Asian region is very vast, and that has led to very diverse cultures and socio-economic status in each population in Asia. This means that the proposed program need to have enough generalizability to be able to be applied to every population in Asia. Furthermore, for the exact same reason, we need to also make sure that the program can be adapted to various cultures and socio-economic status in each place in the region. Therefore, we propose the approach based on the Institute of Medicine model of prevention. This model divides the prevention strategies into three based on the population the program targets, which are the universal, selective, and indicated strategies. So the program we propose is also divided into the three types, and the first type is the universal strategies. The universal strategy is meant for all people in the population, and it's not based on their characteristics. We believe that the right approach for this strategy in type 2 diabetes mellitus prevention is educational programs in either schools, workplace, etc. And as for the selective strategy, this strategy is applied for those who already have risk factors for the disease. And for T2DM, we believe that diet and lifestyle modification is the best choice for the population. This modification can be done in workplace, houses, etc. And the last strategy will be the indicated strategy. This strategy is meant for those people who already develop early symptoms of type 2 diabetes mellitus. And in this case, it is impaired glucose tolerance. For those with the impaired tolerance, we believe that nutraceutical and pharmacological intervention such as fenugreek consumption as well as foglibose consumption will be the best choice for them. With such integrated multimodal approach, we believe that the number of type 2 diabetes mellitus prevalence could be suppressed in the near future in Asia region. However, this study also has limitation, which is the limited number of studies. Because the number of studies that evaluate preventive approach in Asia is very limited, we believe that it may limit the effectiveness of this program to every region in Asia.
In conclusion, we propose an integrated multimodal prevention program to reach a universal healthcare coverage on diabetes in Asia. This model will accommodate various risk factor management as well as various characteristics in need of diabetes prevention. However, this model needs to be researched more extensively so that it could be adapted into various cultural backgrounds in Asia. That will be all our presentation. Thank you for your attention.